The early years of a child's life quite literally present the opportunity of a lifetime. What happens or does not happen to a child through its early childhood can influence the entire course of the child's life, for better or for worse. Good nutrition is one of the cornerstones of child development and the development of a nation. Adequate food and nutrition are essential for physical, cognitive, and emotional development of children, and the quality of life, health, and capabilities in adults.
Most of the economies in Africa are essentially agrarian and informal. Unfortunately, this is a sector that has in the past received insignificant attention from governments and the private sector. However, the trend is changing as more and more governments have come to acknowledge the importance of prioritizing and investing in a sector that has come to be recognized as the bedrock and soul that invigorates the various economies of the continent. Food security without nutrition could have adverse consequences on the economies of member states.
It took us almost 5 years to think about the first 1,000 days. Malnutrition is quite a strange box all across the world. And it's not only about money. It's most about knowledge, practice, culture, and doing the right thing at the right moment of the life of an individual. And today we are here to support the 1,000-day campaign, the first 1,000 days of the life of an individual, because we have all together understood that this is where we have to insist, even though there are many, many other things to do for us to remain healthy. Poverty and starving are unacceptable.
This framework was built for the African continent, and it looks at what happens to a child who's undernourished. But when a child is undernourished and is born, they have a higher risk of dying than that same child with a healthy weight. But if they don't die, they have a higher risk of getting sick, and their cognitive capacity is not developed, and their physical capacity is not developed. That's between the first 1,000 days. But then they have to go to school. And that's where you see the effect of cognitive capacity. When they start dropping out, when they can't keep up, when the elements just are, we created barriers against them they did not deserve because they were undernourished before. So they have a higher problem in schools. And then they want to go and compete in the labor market, and they don't have the same capacity.
When you are underweight, you have a risk to be anemia, to have diarrhea, acute respiratory disease, and also to have fever. If we act during that 1,000 days, we will reduce really the cost. And also 21% of child mortality are associated with undernutrition.
What is the key element of this intervention that has taken a 1.5% progress rate in the last 5 years, 1.5 percentage points, which is relatively impressive. So we need to really understand and analyze how that was achieved, and then we'll know what other countries with similar contexts and similar levels can do to learn from their policies.
We are combining agriculture, that means food production, promote more of water harvesting. We've seen like the kitchen gardens that are a key part of a household's food security. Sometimes they dry during the dry season, so we want to promote more of water harvesting techniques in the community, and also perhaps the drying of vegetables so that, again, they can serve the communities within when the rains are not there.
We really are focusing on assets, income, and expenditures at the household level. And basically one of the things that we look at is trying to see if households, as a result of the economic strengthening interventions and the links to safety nets, are able to achieve improved health outcomes on their own. And this is something that we found in the research. But with the policy framework that we have in Rwanda and the real commitment in terms of poverty reduction, we've seen here that investing in economic strengthening does provide a channel through which households really can make a difference in terms of their health.
The system of rapid SMS has been upgraded because it started by tracking pregnant women and children up to 9 months on the status of their health. But right now we are tracking the first 1,000 days on, especially for maternal health, from the time the pregnant woman is confirmed by health facility and it's being reported by community health workers in our system, so we can track her to remind her when she has to go to for the second dance visit, when she will probably deliver, the 2 weeks before delivery, due date delivery, and also we are asking our community health workers to do postnatal care visit and newborn care visits so that we can know the status of those children. The good thing in Rapid SM is that they are reporting in live. We have community health workers in our villages. When they are screening the children for under 2 years, they just take their cell phone, simply they just compose a report using SMS, and the report is received by Ministry of Health directly, and the feedback is given to the health center, district hospital, and also there is an automated response from the system that instructs the community health workers how to deal with the problem, if any, and also if there's no problem, to thank the community health workers for the report sent by community health workers.
The prevalence of iron deficiency among women and children in rural Rwanda. And the main conclusions from that study are, one, that the prevalence of anemia among women of childbearing age in rural Rwanda is lower than shown by previous demographic and health surveys, and two, that the prevalence of iron deficiency is very low. Our estimates are that iron deficiency affects no more than 15% of the women in rural settings of the northern and southern provinces of this country. Consumption of biofortified beans on a daily basis for approximately 4.5 months improves the iron status of the population.
The resolution, we are going to follow it, and I am sure we will come back here in 2 years with this willingness to change and say that, first, poverty is not a fatality, and we understand that we can do more with what we have. And at that time, in 2 years, we will be in 2016. We will see where we stand with all the measures we have started to implement since 2010. If you invest in the fight against malnutrition, you save billions. And with the local government, with every sector, the social cluster, we are going to work on that. We are all concerned. No child born after launch of the campaign 1,000 Days in the country of 1,000 Hills should be stunted. This will be our motto. Thank you.